So we're going to look at the inner part of the skull here. So we'll start out where the front of the skull is, or basically the front of the cranial cavity. And you'll see that there's a shark fin-like structure sticking out here. This shark fin structure is called the crista galli. The crista galli separates basically the cribriform plate. So there's a flat surface on either side of the crista galli, and so that's the cribriform plate. Inside the cribriform plate are openings. These openings are called olfactory foramina. And you can see the little small openings here on the cribriform plate. In front of the crista galli is another opening in the anterior area in here somewhere. I think it's like right there. That opening in front of the crista galli is called the foramen cecum. Okay, so foramen cecum, which is here, crista galli, cribriform plate with the olfactory foramina. After the cribriform plate, you have this area here that kind of looks like a manta ray. I don't know how many of you know what a manta ray is. Okay, so basically it looks kind of like a manta ray. Well, this area is called the lesser wing of the sphenoid. Okay, so this entire thing is the lesser wing of the sphenoid. Below that, if you look downwards, you kind of see a structure that kind of looks like a butterfly. Okay, and that's the greater wing of the sphenoid. Okay, so you got the manta ray, which is the lesser wing, and then you have the butterfly, which is the greater wing. Now, on the lesser wing, you have these two processes here sticking out. These two processes sticking out are the anterior clinoid processes. In between the anterior clinoid processes is this depression right here, which is known as the tuberculum sella, also known as the chiasmatic groove. It is called that because this is where the optic chiasm sits, right there. Now, the reason the optic chiasm sits there is because there's an opening right here and an opening right here. These two openings are where the optic nerve come out from the eye and go in towards the skull. So this is the optic canal. So you have the optic canals, and in between the optic canals is the optic chiasm, or also known as the tuberculum sella. Below that is this depression down here, which is named after the structure that sits inside of it. The structure that sits inside of it is the pituitary gland, more scientifically known as the hypophysis. So this space here is known as the hypophyseal fossa. Behind the hypophyseal fossa, we have the dorsum sella and then the posterior clinoid processes. So again, dorsum sella, posterior clinoid processes. Now, in the greater wing, we see several openings. One near the hypophyseal fossa right here, which is the foramen lacerum. Next to that is the foramen ovale, followed by the foramen spinosum. In front of these three openings, if I tilt the skull back this way, you'll see that there is an opening right here in front of those three holes. And that opening that's in front of those three holes is the foramen rotundum. Behind the openings, these three openings here, in this spot right here, would have been the carotid canal. But unfortunately, because of the way the model is made, they did not form a nice opening between the opening here and the opening on the underside of the skull. So you'll just have to imagine that the opening is there. But that's where the carotid canal would be.
Would you stick something there?
Maybe. Now, the area where this red smiley face is actually called the petrous portion of the temporal bone. This is the petrous portion of the temporal bone. And on this side of the petrous portion of the temporal bone is, of course, the carotid canal. But on the other side, over here, is where the internal auditory or acoustic meatus is. This is where the nerves from your cochlea and your vestibule would come out of the tympanic cavity and go into your brain, right there. Below that is the jugular foramen. So if I turn it this way, you can kind of see it that way. There's the jugular foramen there.
Lift it a little bit.
It's like, it's hard to, like I can't.
That big hole?
That big hole right there. In the, like, back here. I'm trying to.
Okay.
Hey.
Okay, I know it is. I got it.
Trying to show you as best I can. Okay.
One more time this way, Dr. McCall. I got it.
Okay.
And you're pointing to, let me just make sure I got that correct.
That'd be the jugular foramen.
Okay.
And then right here is the small little opening right here is actually a part of the condyloid canal, which is better visible on the other side. And I'll show you that there. All right. You'll see here that there's actually a protrusion here on the inside of the skull, right at this spot right here, which matches up with the protrusion on the outside of the skull, which is here. So there is both an internal and an external occipital protuberance. So just out of curiosity, just for you to know. Now, this depression here, this groove that comes across here, is actually where the transverse jugular would actually sit inside the skull. Then, as you see it curve downwards, you can literally see the groove curve downwards. When it curves downward, this is actually where the sigmoid sinus would actually sit. So you have the transverse sinus here, sigmoid sinus, and then it would turn into the jugular, the internal jugular, and come through there and form the jugular vein that would then come out and go down the neck. Are you good?
Yes.
Fantastic. We can stop on that point and then